worked very hard under the able leadership of Dr. Manish Singhal and other senior members of various allied group specialties. And my senior colleague O.P. Kharbanda has contributed immensely for creating contents for the dental specialty. So we have now at this point of time multiple lessons of e-content which are loaded on iGot platform. These are all evidence-based, effective guidelines which are so simple to understand. And as you will see that there are assessment also which is inbuilt into it. Majority of the content which are built, it cuts across majority of the specialties. Many of the contents which are created by one thematic group is going to be relevant for the other thematic group also. And as you know, already we have launched the thematic groups for adults, for children, for the newborns, and the Ayush doctors. This is the 5th one which we are launching, and the 6th one is for maternal group, and the 7th one is for the nurses. So we have seen all the contents. These are of international caliber, and these are going to be used not only in India and outside also. And I'm very sure they will go a long way even to ASHA workers and ANMs who are going to provide care for COVID care patients. The next step in this would be creation of courses which will be on learning management system. And there are a lot of things which have to be taught to many of the allied healthcare professionals face to face. So we have also created a matrix. While they will do the e-contents, there will be in the simulated centers in the dedicated COVID hospitals or medical colleges, face-to-face learning is going to happen for all of you. So with these words, I welcome all the leaders who are going to speak in this thematic launch. And with these words, I hand over to Kavita.
Thank you, sir. Thank you so much. And as we are very appreciative that for all of the clinicians who are here today, you are juggling patient care. Dr. Devrari here is juggling interviews. Dr. Manish has come running from some other interviews. All of the various, clinical professionals here are all taking care of patients. So we appreciate all of you who are here today because it's very critical. And it is a lot of different thematic areas that we are going to cover. And on that note, while, we usually have with us, and today we will have through recording, the director of the All India Institute of Medical Sciences and one of the biggest champions for our program, Professor Randeep Guleria, who has really been such a force behind each of us for, pushing this, and really AIIMS has been taking the lead under his guidance and vision. So I'm going to request our team here to please play the message that Dr. Guleria has recorded for all of us on this occasion today. I will move over next to another very important, small group today that we have in India, but have played a very important role, particularly in the ICUs, which is respiratory therapists. So may I call upon the General Secretary of the Indian Association of Respiratory Care, Mr. Jithin Sridharan, please, can you come and give us some brief comments on the work that you all have done? I've seen some of the work you've done, but it would be great for everybody also to just get your perspectives on the role of RTs. Jithin, over to you, please.
Thank you, Dr. Kavita. Most respected Dr. Randeep Guleria and his team at All India Institute of Medical Sciences, New Delhi, and Dr. Ashok, Madam Kavita ji, Dr. Kharbanda, Sree Senthil Pandyan ji, Dr. Manish ji, distinguished members of the Empowered Group, and the eminent medical practitioners and healthcare providers who is listening to us from different locations in the country and across the globe. I'm here on behalf of the Indian Association of Respiratory Care, which is the sole professional organization for the practicing respiratory therapists in our country. I'm so delighted to represent one of the most rewarding and vibrant community in the healthcare field. who gained enormous attention during this particular pandemic. Respiratory therapy, in fact, existing in India for the past 25 long years. We remained silent and unnoticed warriors for decades together. COVID-19 pandemic has brought special attention on the respiratory therapy profession as a whole. It brought enormous challenges to our profession as well. However, we managed to transform them as opportunities to grow. Today, we are trusted partners of the multidisciplinary team. You may find an RT in the pre-hospital care, OPDs or diagnostic centers, ICUs, rehabilitation centers, home centers, and so on. There are only a handful of qualified RTs practicing in India, less than 3,000 graduated RTs in all these years. Many of them are working abroad, but when there was a call for help, our team gathered together under the umbrella of Indian Association of Respiratory Care with a distinct vision. Our team contributed enormously, worked tirelessly with many governmental and non-governmental organizations in the fight against COVID. We functioned more than 14 to 16 hours per day in the hospital, especially in the intensive care units, and compassionately devoted our free time for the dissemination of our knowledge to other healthcare providers' empowerment. The response to our 2-day certificate course, The Fundamentals of Respiratory Care in COVID-19, is the typical example of that. More than 6,000 direct beneficiaries of the certificate program as of today, since its launch. Over the past 1.5 years, our academic team, under the auspices of the Indian Academy of Respiratory Care, organized more than 40 dedicated free training and certificate programs. We released the COVID-19 special issue of our official index journal, the Indian Journal of Respiratory Care, in the month of May. And more than 560 volunteers registered in the ministry's COVID Warriors portal immediately on the next day of the call for support from the HRH cell. Because we already had a database created for the same based on the lessons learned from RT colleagues spread across the world. We use their expertise, their experience, their time immensely for supporting their counterpart in the real battlefield. More than 25,000 RTs from across the globe lined up behind us to help us, especially in the form of virtual consultation and academic assistance, training. We, in association with the Canadian board and the Canadian government, developed simulation-based modules in respiratory care maneuvers for the general healthcare practitioners. That includes basic operations of the ventilators, oxygen therapy, emergency crisis management, rehabilitation, home care, etc. Now, more than ever before, as you know, the role of RTs or respiratory therapists is vital to the healthcare field and health of our nation. On behalf of the Indian Association of Respiratory Care, I take this opportunity to thank Dr. Kavita particularly and her entire squad in the ministry for bringing us into lights and using our proficiency into efficient integration of patient care management during the COVID-19 period. Thank you and congratulations to the IGOT team for completing such a huge task. You designed the modules in the finest manner. I wish this platform to emerge and continue as one of the world's best and largest online medical education platform in a government sector, which is more affordable compared to any other platform. Most of the courses are free of cost as well. Thank you all for the remarkable work that you all are doing, my colleagues, friends, and in other allied health specialties as well. Once again, thanks a lot to the frontline workers. Our respects come to you all, and thank you for your sacrifices that you make each day to care for others. Thank you so much for this great opportunity. Once again, we look forward to continue and work together again in the future. Thank you so much.
Thank you. Thank you, Jithin ji, for that for those very, very enlightening and empowering comments, not just to your group, but also to the several professionals that are gathered here today. And we have a wide variety, and like you said very clearly, it truly is, everybody has to be the best in their field, and together we can come and make something meaningful happen. And the frontline workers really have had it, somebody was saying, which is the profession that has suffered the most in this entire last 1.5 years? It has been healthcare workers, without question. So again, our heart goes out to each and every one of all of the people in our profession. But thank you, because we as people sitting in the ministry offices cannot thank you all enough, because we could not have done anything without everybody sacrificing your time and your safety, most importantly, during this pandemic. Thank you.